very, very minute.
Wow, it just sounds amazing. We're going to talk more about that in just a second, but we want to go to line 1 with Meyer. Meyer, go ahead with your question for Dr. Perrin. Thanks for calling.
Yes, Dr. Perrin.
Yes, Meyer.
I got a twitch in my right eye all the time, and I wonder if that was from laying on my right side or whether it was from I was hospitalized for 7.5 months with myasthenia gravis.
Yes.
And I went to an eye doctor 3 weeks ago, and she didn't give me no satisfaction on that twitching, and but she did change my lenses. But changing the lens didn't do any good.
Did you see an MD eye doctor, an ophthalmologist?
Yes, I did.
Yeah. Well, the one thing I can tell you is usually when we deal with twitching, twitching occurs because of inflammation or reaction from the nerve that supplies the muscle right on this part of your lid. And there are medications that can be given that may be beneficial. There are ophthalmic plastic surgeons in town, and one even comes to our office. They know how to treat this, are used to dealing with this. Most ophthalmologists don't deal with it a lot. Neurologists sometimes deal with it. And you've heard of Botox, the original thing that Botox did, where it took away wrinkles and made a lot of people wealthy, just helping vain men and women, is the fact that it was originally to treat things like twitching and nerve problems. So you might want to consider, you could even call back if you saw an ophthalmologist and ask her if she would have an individual in mind who could help her. That individual comes to my office, and she could possibly refer you to that individual. He also goes to another office in town. He's in Bluffton, and he's an excellent person, and he could maybe give you some help. So you might do that, or you could get another opinion. We'd be happy to see you, or we could easily refer you to that individual.
Thank you very much for your call, Meyer. We appreciate you watching and supporting PBS 39. We're going to go to line 2 in just a second with Mary, who has another question regarding cataracts. But I wanted to ask you, Patty, and Dr. Perrin, will you need to go through this surgery again in your lifetime, or will this pretty much take care of it?
Well, the capsule, in fact, I'm looking at what Mary's asking in the next question, and the capsule which surrounds the lens can get a little cloudy, but literally you set somebody up to a laser, and in less than a minute you open a small hole in the center for visualization, and it's still perfectly centered. And so it's a minor procedure, although it's laser surgery.
Right.
But it's a real small procedure, but the cataract itself does not come back.
Right. And do you need to wear glasses still to this day?
No.
They're gone.
None.
How do you feel about this experience?
I think it's the best thing I've ever done. It's so awesome. I mean, I can see, you know, I don't have to, I'm constantly reaching for those glasses, and I don't have to anymore.
And, yeah.
I have 20/20 vision.
I know, they get in the way sometimes.
Yeah, they were always falling off my head. My grandkids
Exactly.
were always grabbing them.
I feel like I'm wearing equipment on my
Yeah.
face.
She actually still was reaching for them after she had the surgery.
I was.
Out of habit, I'm
Yeah,
sure.
you do that.
Well, we have 10 minutes left in the show. We have a lot of ground to cover, but we'll go to line 2 with Mary. Mary, thank you so much for calling. Your question, please.
Dr. Parent did surgery on me in 90 and I think 91.
Wow.
I came from Iowa.
It couldn't have been me. I'm too young.
And I've had that film come up a couple of times. Why does it keep coming back?
Usually the film does not come back. Are you having floaters with it, or is the film something that, who told you the film would come back?
You did.
When was that?
About 5 or 6 years ago.
Oh, 5 or 6 years ago. Do you feel that you feel your vision's diminished because of the film now?
I'm not sure. I have another, I have RP and Usher.
Oh, okay.
We went to high school together.
Right, I know who it is.
Yeah.
Well, what I can tell you, Mary, is that retinitis pigmentosa causes increased inflammation in the eye. And it's inflammation in the retina, it's inflammation in the posterior chamber, in the vitreous, and all through, and it does cause more inflammation. And in certain cases, the film can recur in those people. But also it can be just due to retinitis pigmentosa, as you know, is an inflammatory disease. And people are working on it hard, but the most common cause of diminution of vision with that is the retinitis pigmentosa, unless we said there is a recurrent film.
Okay. Thank you very
We'll
much
be
for
seeing
calling,
Mary back in there, I hope.
All right.
Okay.
Now, let's, because we did promise we'd spend some time talking about glaucoma, and it's an
Yes.
eye disorder affecting people, like 200 people aged 50 and younger, 1 in 200, I should
Yes.
say, and 1 in 10 over the age of 80. And glaucoma is actually an umbrella for several eye diseases.
Yes.
Is that correct?
Well, glaucoma used to be described as high pressure in the eye, but now it's described as damage to the optic nerve. And damage to the optic nerve certainly can come from high pressure in the eye. When it comes from high pressure in the eye, that causes compression on the nerve, which decreases the vascularity or the blood supply to the nerve, and therefore part of the nerve dies. Or you can have decreased perfusion to the nerve. Certain people that have low blood pressure, or when they sleep and have sleep apnea, they aren't perfusing their nerve, and therefore they aren't getting blood supply to their nerve, and therefore they have glaucoma with normal pressures. So it is a variety of diseases, and the main thing is, if you look in a patient's eye and you make the diagnosis of glaucoma, you want to look at the optic nerve and see if it shows damage. You want to look at their side vision and see if it shows damage. In other people also, you need to ask if there's family history of glaucoma, because they may not have damage yet, but you can see changes occurring in their nerve. They may not have damage you can document, but you certainly want to keep those carefully looked at, or even treat some of them, maybe possibly treat one eye.
The relation between diabetes and glaucoma.
Oh, diabetes is a disease caused by a vascular problem. And in other words, what happens with diabetes is there's increased leaking from vessels, and the vessels aren't perfusing the rest of the body quite as well as normal. And the same thing, we're having decreased perfusion to the optic nerve. So diabetes, people with diabetes have an increased risk of glaucoma. On the other hand, not all diabetics, or very few percentage-wise, have glaucoma, but it's still increased risk.
And we talked about the risk factors. We talked about the low blood pressure. We talked about diabetes. What are the other risk factors for glaucoma?
Well,
and the genes, of course.
Yeah, absolutely, inherited, and that's what I just mentioned. If there's a family history, that's a big thing. You want to certainly keep track. And another thing is that there is a disease called narrow-angle glaucoma, where just the shape of the eye can cause, when your iris dilates, it can cause you to have a closure of the trabeculum, where the fluid goes out of the eye. And people literally, I've had people come in with angle closure glaucoma, and they told me if they couldn't get rid of this pain, that they literally would consider committing suicide. It's that
terrible.
painful.
Yeah.
So that's another type of glaucoma, which is a little unusual.
And
we use a laser to take care of that.
And the symptoms that you'll want to go see your eye doctor about if you have
angle closure glaucoma, it's pain and blurry vision,
All
mid-dilated pupil. If you have chronic glaucoma, it really sneaks up on you so quickly that people come in and have no idea.
Okay.
They really don't know. So I'd say routine exams through your eye doctor.
And any radical changes, see your eye doctor.
Yes, absolutely.
Okay, well, we have 2 calls waiting on line 1. We'll go with line 1 first. Go ahead, Greg. Thank you for calling. Hello, Greg? All right, well, Greg wants to know why his eyes are watering all the time. Do you have any?
Well, yeah, sure. There's a couple reasons.
Okay.
Greg, one of the reasons could be that your tear film is not as thick as it used to be. Tears are made up of mucus, oil, and water, and the mucus actually holds the tears on your eye. The water hydrates your eye, and the oil keeps the tears on your eye. So any of those 3 things could be diminished. Sometimes just using artificial tears to stabilize your tear film can keep your eye from watering, believe it or not. Another thing is that the drainage system could be blocked or clogged. And those are something you probably should see your eye doctor and let him determine that. They'll run some tests and see if they can determine which thing it is.
All right, thank you very much. We'll go to line 2 now with Doris. Doris, thank you for waiting on hold. Go ahead with your question for Dr. Perrin. Is Doris there?
I'm here.
Hi, Doris. Go ahead and ask your question, please.
Okay, I want to know if seeing blind spots in both eyes is reason for me to rush into you. My appointment is not until the latter part of January.
Well, I can't say, Doris, for certain, but do you feel like this is something new that's just recently occurred?
Well, yes, in the last week or so.
Well,
I am your patient.
If it's, Doris, if it's within the last week and you feel it's a change, call the office in the morning, say you talked to me tonight, and tell them I said to get you in, and we'll take a look at it.
And she is one of your patients.
Yeah,
she says,
absolutely.
so.
We'd be happy to see you, Doris, and we'll try to
Many
determine
years, remember?
that. Yeah, I remember.
Sounds like you need a
You're that
follow-up.
good-looking lady I take care of.
Yeah.
Okay.
Yeah, you were that good-looking man.
He says that to all the ladies. All right, we have Bob who's called in, and he does not want to be on the air, and that's fine, but we appreciate your call, Bob, and we understand. But he says, does cataracts in your early 50s lend itself to future eye problems?
Well, actually, it does not. Cataracts with an intraocular lens implant, in many cases, particularly farsighted people, which Patty was farsighted, some other people operated on farsighted. We just, at the ocular surgery news meeting where I sat on a panel there, it actually, if you get your cataract removed, your eye becomes more stable because your cataract can help cause narrow angle glaucoma. And if the surgery goes great and everything works well, it actually makes your eye more stable, makes your eye healthier. So I don't think, first of all, if you have a cataracts and there's a reason, like diabetes, then diabetes can cause problems down the road. But if your surgery goes well and everything works real well, the cataract surgery itself should not cause any problems in the future.
All right. I want to talk about snow blindness and wearing sunglasses, and is there any reason for that?
Are you trying to hex us? Or?
Not really. No, not at all. I don't want snow, believe me. But because we had a show back in the summer, and you did talk about the importance of sunglasses.
Absolutely.
And so the snow making brighter conditions, is it necessary?
Well, you know, we always recommend that. And I said years ago, a big company that made sunglasses, very high-end sunglasses, did a study that showed their sunglasses were great. But in reality, they kind of backfired because nearly every sunglass has UV blocking material. Some are polarized, and those are even more beneficial. But I think we do feel that wearing sunglasses diminishes the risk of getting macular degeneration, diminishes the risk of getting cataracts, and therefore I do recommend it. And we also, the implants that we put in people's eyes now have ultraviolet tint in it. The original implants didn't, and some of those people did get a thing called erythropsia, where they had red vision from real bright light, and those people literally had difficulty seeing, like later that night. It would kind of burn their macula a little bit. So today with the UV tint, things are better. Did
Patty, with her intraocular lens implants?
Absolutely.
Hers are tinted as well?
Just mildly tinted, and they're all they're all a little different. In fact, we usually put different lenses in different eyes so that you have a ability to see at different distances. And Patty had two different lenses. One has a little different tint than the other, but both are protective.
Okay, very good. Dr. J. Rex Parent, ophthalmologist and eye surgeon, thank you so much for being here and being such a supporter of PBS 39 over the years, and our 17th year now on Healthline.
I've really been here that long.
Patty Kelly, thank you very much for your testimonial tonight, and hopefully that will inspire others to have their eyes taken care of as well.
I hope so. They did a wonderful job.
And you did a wonderful job on the program tonight. Thank you.
Thank you.
All right, next Tuesday night we'll be back for another show, Nutrition and Healthy Living, part of our Women's Health Series, and Jennifer Blomquist will be here as your host. Julia Just and Kathy Whirl will join her here on Healthline here at PBS 39 HD. Until then, take care of yourself. We wish you the best of health always. Good night.
The preceding program on PBS 39 was made possible in part by
The Eye Center of Fort Wayne is devoted to eye care. Dr. Rex Parent, along with medical optometrists James French, Paul Gill, and Gregory Zink, specialize in medical and surgical eye care. For refractive treatment, the Eye Center of Fort Wayne utilizes technology such as Bausch & Lomb custom LASIK and multifocal refractive lens exchange. More information is available at 424-5656 or drparent.com.